So this video is going to give an overview of new HIV diagnoses in Ontario for 2014. So what can you expect to learn from this video? Well, hopefully you'll understand what the trends are in new HIV diagnoses for Ontario up to 2014, and to understand some of the limitations of this information. So first, where does this information or this data come from? Well, the data comes from Public Health Ontario Laboratory, their surveillance program. And how this information is collected is as follows. So first, when a person decides to get an HIV test and they see their healthcare provider completes a lab form. Now, the specimen is then collected and sent to the Public Health Ontario Laboratory with the lab form. If the result is HIV positive, the result is reported back to the healthcare provider as part of clinical care to give results to the person and to the local public health unit. The result is also shared with the Laboratory Enhancement Program, which is a surveillance program that sends a data collection form to the healthcare provider. So the data that I'll be referring to today really comes from two places. It comes from the lab form that's collected as part of HIV testing, and also on the follow-up form, which is sent to people with a new HIV diagnosis. So speaking of new HIV diagnoses, what exactly do we mean? Well, a new HIV diagnosis is based on having a first positive HIV test in Ontario. So an important thing to know is that when we're talking about a new diagnosis, this is not the same thing as a new HIV infection or incidence. We know that people can be infected with HIV for many years before they become diagnosed, and so that's an important distinction to know about this. It also includes people who are already diagnosed or know that they have HIV, but they've moved and tested for the first time in Ontario, either from elsewhere in Canada or from another country. So I think until we actually trust what the statistics say, we have to think about what they don't say. And so it's important to know that there is some missing information that's important to realize. So we know that about 25% of new HIV diagnoses are missing information on risk factors, 40% are missing information on ethnicity, and currently we don't have any ability to document transgender status. So let's start with looking at trends in HIV diagnoses by sex. So this graph shows the total number of new HIV diagnoses over the past 10 years in Ontario. And you can see that in 2014, there was a small increase in the number of new HIV diagnoses, but still consistent with an overall declining trend and still lower than most years in the past 10 years. When we look at this by sex, first looking at males in the gold bars, we can see a similar pattern with a declining trend and actually a small decrease in 2014 compared to 2013. When we look for females, we did see an increase in 2014 compared to 2013, a small increase that was still lower than previous years and consistent with a long-term trend and year-to-year variation. Well, if we look at HIV diagnoses by age group and sex, as shown here, a couple of patterns emerge. So first, the important thing to know is you see diagnoses can happen to people of all ages, from young through to seniors. And when we look at trends by males and females, we see some differences. So for females shown in green, we can see that the most common age group at diagnosis are women in the years 30 to 34 years. And if we look for males, we see two peaks, a peak sort of in the mid-30s and a peak in the late 40s. Now, this is just over the past 3 years, so it's helpful to look at longer-term historical trends to understand how some of the age patterns may be changing amongst people diagnosed with HIV. So let's start by looking at female diagnoses. This graph shows that same age distribution, but now for 15 to 20 years ago, 1995 to 1999. And what I'll do is I'll advance over the next 5 years, then next 5 years, and then finally the pattern that we've seen most recently. And now if you look at comparing the first to the most recent pattern, you can see a couple of things. So first, that you see consistently that the peak age is always women in the 30 to 34 year age group. But you can also see, comparing the earlier time period in blue to the more recent time period in green, that there has been a shift over time towards an older age at diagnosis amongst females in the province of Ontario. If we do the same thing now for male diagnoses, this is the pattern from 15 to 20 years ago, and we see a different pattern that emerges over time. So advancing by 5-year time intervals, there's a couple of things to notice. So first, again, comparing the earliest to the most recent time period, the first thing to note is that we see this consistent peak with all of the different 5-year periods that are looked at. This is what we call a cohort effect, which means that there's something unique about this generation of men that has led to them having a higher proportion of diagnoses over time. What we also see is a shift towards younger ages amongst males who are diagnosed with HIV in the province of Ontario. So now, exploring this a little bit further, we can look and see what is the pattern amongst males who are not known to be men who have sex with men. Remember, there's a lot of missing information. And these are, again, looking at the pattern, we see the cohort effect that I explained in the previous slide. But if we look at cases that are known to be men who have sex with men, this is where we see a striking cohort effect, as well as that shift towards younger ages. So we think this is certainly a trend over the last 10 years amongst men who have sex with men in the province of Ontario. So when we're talking about health regions, we're talking about 7 different parts of the province as shown on the map here: Northern, Southwest, Central West, Central East, Eastern, and then Toronto and Ottawa separately. So this graph shows the number of new HIV diagnoses in 2014 in blue compared to the average of the previous 2 years. And we can see declines in Toronto and Southwest with small increases in the other health regions. Now, when we look at the trends by males, we can see decreases in Toronto, Southwest, and Central West, with either stable or increasing trends in other regions. But again, these differences are small in comparison to the previous years. When we look at trends amongst female, remembering that overall we saw an increase in female diagnoses in 2014, we can see increases in Northern, Eastern, Central West, and Southwest, with declines or stable numbers in other health regions. So let's now turn to HIV diagnoses by population, or otherwise known as exposure category, where cases are divided according to the likely ways that they became infected with HIV. So again, remember that 25% of cases are missing information on exposure category, and we know that these cases are not missing information at random, and so this does affect the way that we're interpreting the information. So it's an important limitation to keep in mind. But when we look at trends overall in the proportion of new HIV diagnoses by exposure category, we do see some clear long-term trends. This looks at the past 10 years divided by 2-year time periods, and you can see over time an increasing proportion of new HIV diagnoses are amongst men who have sex with men to 61% in 2014. We can see correspondingly a small increase to 4% amongst men who have sex with men who are also people who use injection drugs. We see somewhat variable trends for people who use injection drugs to 8% in 2013-14, declining proportion of cases amongst people from HIV endemic countries, and heterosexual cases. Now, if we look at males, we see similar patterns: increasing proportion amongst men who have sex with men and MSM who are also injection drug users, variable for people who use injection drugs, declining for HIV endemic, and sort of variable for heterosexual. When we look for female HIV diagnoses, we can see for females who are also injection drug users, there was an increase in the proportion of new diagnoses in 2013-14 to 18%, with a declining proportion in women from HIV endemic countries, variable patterns in terms of cases in women who acquired HIV through heterosexual sex. Finally, let's turn to HIV diagnoses by ethnicity. Here as well, keep in mind that there's a lot of missing information, also not missing at random. So 40% of cases have missing information on ethnicity. We only have 6 years of data for ethnicity, so longer-term trends are difficult to interpret. Essentially, we do see variation from year to year or over these 2-year time periods for each of the ethnicities. But the most common ethnicities in Ontario are cases are identified as being white and Black and Latin American. For males, we see similar patterns. Again, the trend are very variable. For females, we do see it's much more common for someone who's newly diagnosed to be identified as Black compared to white. So in summary, what are the take-home messages? Well, we know that new HIV diagnoses by exposure category are essentially consistent with longer-term trends. We see some smaller changes in 2013-14 compared to the previous 2 years, except for amongst females who injection drugs, which did increase in 2013-14. When we look at new HIV diagnoses by ethnicity, we see varying trends really compared to the prior 2-year periods. But again, these are both very difficult to interpret due to missing data. Next, when we look at our new HIV diagnoses in females, the peak age is amongst women aged 30 to 34 years at diagnosis, but we have seen a shift to older age at diagnosis over time. We see a small increase in diagnoses in females in 2014 compared to 2013, but this is still lower than previous years. We saw an increase in Northern, Eastern, and Central West health regions, and an increase amongst female who use injection drugs. So what are some possible explanations of these trends? Well, we know that it could be due to an increase in infections, but there are many other factors possibly explaining this, including small increases between years are not uncommon. We see it's typical to see variation from year to year. And there may have been efforts to increase testing amongst females who use injection drugs, for example, as part of hepatitis programs. So this is certainly a trend to watch. Next, when we're talking about new HIV diagnoses in males, we see a stable number of new HIV diagnoses compared to 2013, but we did see these 2 clear trends by age. The cohort effect of men born in the 60s having a higher number of diagnoses compared to other generations, and this is more pronounced in men who have sex with men, and a shift to younger age at diagnosis among men who have sex with men that's emerged over the past 10 years. And what are some possible explanations of this? Well, it's important to note that this is consistent with some trends that have been seen in other places, particularly the shift to younger age amongst men who have sex with men, and it's possible this reflects generational differences. And a key point to note is this may include underlying HIV prevalence. Men born in the 60s experienced the height of the HIV epidemic, where prevalence of HIV likely became very high, and this may be an underlying factor that's contributing to them having the highest number of diagnoses each year. So what's next for OEASY? Well, we're going to be looking further into these trends. We're working to change the lab forms to reduce missing information, looking at ways that we can adjust for the missing data to get more meaning from this data and be more confident in the findings, and to shift from this mutually exclusive exposure category approach where one person is counted once for each exposure category to recognizing that these aren't mutually exclusive categories and shifting to an overlapping approach where people can belong to one or more of these priority populations. So thanks for watching.